Whether Boise State Public Radio brings a smile to your day, some inspiration, or a greater connection to Idaho and the world, we're proud to be here with you. Federal funding, about $1.60 per person annually, helps keep these trusted services strong and accessible to everyone in our community. Learn how you can safeguard local public media stations like ours by visiting protectmypublicmedia.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. More than 1,900 scientists are calling out the Trump administration, saying it's waging an assault on science. In an open letter earlier this month, researchers from across the country accused the White House of ignoring scientific evidence and sidelining experts. So today, we're going to take a closer look at what this means for science as well as the public. Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is joining us today to talk more about this. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, almost 2,000 engineers and scientists and researchers penned this open letter calling for a stop to what they're calling the Trump administration's assault on science. Can you first tell us what this letter said?
Right. So I'm in total agreement. And in fact, I commented on the show last week with you that there is this attack on science or anti-science being spread. And basically what they're pointing out is that under President Trump and Secretary Kennedy of the Health and Human Services, the NIH made sweeping cuts to research that is critically important to fund basic research that occurs in universities, particularly, and has targeted even some researchers, and that at the same time, which we talk about on your show all the time, the administration has been spreading disinformation, information about science that we already know to not be correct. And so this is I'm not sure that listeners have a full appreciation for what this means. What this means is that there are very large amounts of research. And we talked about one big one last week, Gemma, when you brought up about the women's, the long-term, several decade women's research program. But what is happening is these cuts are eliminating funding that supports these scientists. And what we are seeing at the same time is other countries now looking to take advantage of this and reaching out to our scientists and say, come to our country, we will set you up, we will support you, we want to take over this leadership position that the United States has held. And we are already hearing of some of our scientists taking them up, considering leaving the countries. Others that just don't know what's going to happen to their research. Some of it is going to be stopped midstream without the funding. And so this is an existential threat. We should remember that since President Kennedy, I remember being in elementary school when President Kennedy said the United States is getting behind in science. We aren't scoring as high as Russia and some of the Asian countries in our schools. We don't have the pipeline of new scientists, and we aren't leading the world in science. And he made a very determined effort to improve that situation, and we did. And what the significance of the NIH is that why the United States has taken over in this area is that it funds research that pharmaceutical companies and others, drug developers, won't fund because it's too speculative. And then when we see that things work, then those companies can pick that up and do the really expensive research that has to go into the clinical trials to get things approved. This has led to all the advances we've made in cancer therapeutics, in all kinds of areas where everyone sees the United States as the leader.
Dr. Pate, how unprecedented is a letter like this to a presidential administration?
Well, one like this about this particular subject, this, to my knowledge, this is unprecedented. There have been other things that scientists are stepping up, and I applaud them. I think physicians need to do the same thing and make our voices heard. For example, there has been, back at the beginning of the pandemic, there was a document called the Great Barrington Declaration that was issued by a whole lot of people on the fringe, including someone that now leads one of these United States government health agencies. And it purported that we should, in essence, just let the COVID infection rip, that, it would be good if younger people got infected, then they'll get over it. They'll be immune. They can go back to work. We don't need to do any other precautions, et cetera, et cetera. And there were scientists and physicians that did step up to write and say, this is hogwash and dangerous. So it's not unprecedented, but it is not common.
Dr. Pate, moving on, I want to talk about some research coming out about Alzheimer's. The Alzheimer's Association is urging doctors to use some new testing that they say could diagnose the disease earlier. Can you tell us a little bit more about this?
Yes. Alzheimer's disease has been vexing the medical community for a long time. It's difficult to diagnose. We believe the disease starts probably more than 20 years before we can actually detect the signs and see the evidence. And we have been trying all kinds of research, trying to figure out how can we get at the cause of Alzheimer's? How can we get at earlier diagnosis? And how can we get at treatments that might be effective early on to help slow down Alzheimer's? Because any family, and I'm sure there's many that are listeners that have family members affected by this disease, you know how devastating it is. And this could allow us to slow down the rate of dementia, which is actually increasing. And so having a test that we could do would be very helpful. Even when we see early cases of Alzheimer's, it's not always exactly clear that it's Alzheimer's as opposed to a number of other potential causes of dementia. Some of our best specialists without this test, they only get the diagnosis right when it's early, about 73% of the time, because then as it plays out, we see, oh, no, it's not Alzheimer's, it's something else. It's been, the early tests are suggesting that with biomarkers, you could increase that accuracy rate up to 91%. And that would be huge, allowing us to treat earlier.
Dr. Pate, the CDC has just come out saying that cases of whooping cough have more than doubled this year. So I want to talk about this because now we know that whooping cough cases have doubled. And then we have the measles outbreak that started in Texas that doesn't seem to be slowing down or getting any better. So Dr. Pate, what do we need to know about both of these? And has either of these impacted Idaho to the extent that they've impacted other states? I mean, we've had both measles and whooping cough in Idaho, but it seems that these are definitely spreading in ways that they haven't previously.
Right. You're absolutely right. So first of all, let's take pertussis. So for people that don't recognize the word pertussis, that's whooping cough, as it's commonly known. And this pertussis is a disease that is spread in the air, by coughing, by sneezing, by being in close contact. And the real big concern is transmitting that bacterial infection. This one's not a virus, it's a bacteria, to a young child, someone under 5, because they are the ones most likely to get severely ill. Although certainly it can happen to adults. We had an adult in Idaho die of pertussis in the past year. So that can happen, and it can happen with immunocompromised persons. So it's a serious infection. Now, before we had the vaccine, we would see up to 200,000 cases in the United States of whooping cough or pertussis, and we'd have 9,000 people die, primarily children. And so right now, with this doubling, this is the highest level that we've recorded since, I think, the 1950s. And
gosh.
It's not unrelated to well, especially if you draw this out as at this rate, as you mentioned, that we've already doubled where we were this time last year. If this keeps on track, and I think it will, we'll get up to over 70,000 cases probably. And that's going to push us back to where we were in the 50s. So we are losing a lot of progress. It's not unrelated to the measles problem, because both are related to under-vaccination. And so, unfortunately, I do think we're going to see more whooping cough. This is tragic because we can prevent it. As far as Idaho, we haven't had a lot of significant outbreaks of pertussis, but I will qualify that by adding yet. I do fully expect to see it. You and I talked last year about one of the Boise State games having to be canceled or postponed because the opposing team, and I believe they were in Oregon or Washington, right next door to us. Yeah, Oregon, they had a big outbreak among their team. So I do expect to see more. We haven't had much to speak of yet, but I suspect it's coming. On the measles,
well, and Dr. Payne, I'll say this really quickly about whooping cough. Both of my kids had exposures at school to whooping cough this academic year.
Well, that's right.
So
that's right.
This was
we
right.
know there's been cases. Yes, exactly. And it's just a matter of time till we see much more. And similarly, just as you correctly stated about measles, we have not got good control of this. The way you get control of a measles outbreak is you vaccinate those around where the outbreaks are happening and with the MMR vaccine. And unfortunately, back to what we were saying with the anti-science, we've had a health administration that has been downplaying the MMR vaccine and raising concerns that we've already proven are not legitimate, particularly the claim of autism associated with MMR vaccine that has been thoroughly and repeatedly debunked, but our administration keeps raising that. And so people aren't getting the MMR vaccine, and now it's spreading. It has, I'm sure as of today, I think on Friday, we're at like 880. I'm sure we're well over 900 cases by now. And frankly, it really is probably in the thousands because a lot of these don't get reported. It's already affecting 29 states. We're not one of them. But as you pointed out, Gemma, we had last year an outbreak of measles in a family, I believe in Nampa. And I'm certain eventually we're going to see it. And I think this is a terrible shame.
And we should note very quickly that President Trump did sit down with an interview with ABC's Terry Moran, I believe yesterday or the day before, and he was asked about the MMR vaccine. And he was pressed about it, and he did say to Terry Moran that he would recommend the MMR vaccine. Dr. Pace said it would not require it, but he said he would recommend it. So hopefully that might help some people decide to vaccinate at least their children.
Yes, and I applaud President Trump for that. That needs to be a clear and consistent message from his Secretary of Health and Human Services, though. But I do applaud President Trump for that, and President Trump has done some great things for vaccines, particularly Operation Warp Speed during his first term that gave us the COVID vaccines, which was a tremendous success. So I applaud him for that.
So, Dr. Pate, according to a report from CBS News, the FDA is drawing up plans that would end most of its food safety inspections. Now, the FDA says it wants to move a lot of these inspections to state agencies. So, what does all of this mean? I mean, do we need to be concerned about our food being tested properly or not?
Well, that's a great question, and I'm not certain of the answer yet because the devil is in the details. So I can certainly imagine some really good reasons for taking that move. The problem is that I don't trust the administration because of some of the really anti-science things they're doing. So are they doing this in a way that is going to increase the efficiency and the quality of food inspections, or is this one more kind of tearing down of our public health infrastructure? And so what I would like to see is the details. Okay, that could be a really good idea, but let's hear the details. How is this going to work? How is it going to be funded? Because if you're now having 50 states doing it, are there going to be standards? Are we going to use best practices? How is this going? Are states going to have enough money to fund people to do this? I just want to know the details. It could be a fantastic idea, but I have to say I'm skeptical.
So there's also going to be a new law in the books here in Idaho come July 1, and it will remove a requirement that the state enforces what they call minimum standards of health, safety, and sanitation for public swimming pools. So, Dr. Payne, I want to know your thoughts on this because we should point out that in June 2023, there were 3 cases of Legionnaire's disease reported at a gym in Garden City. And when they inspected, they identified the hot tub at that gym as the source of the disease. So again, should we be concerned as the public when it comes to our public pools not having to go through these inspections?
Very possibly, and
okay.
as skeptical as I am of the this announcement about the food inspections on the FDA, I'm more skeptical of this. And the reason is because I don't think the legislature enacting used due diligence. In other words, talk to experts. And, why the rush? They are cutting this off in it's either June or July. And
July 1st.
Why isn't there? Yeah, July 1st. So why isn't there a plan? Why isn't there? Why aren't we taking time to educate everyone? If the state's not or the public health districts aren't going to do this, why aren't we issuing standards that have to be used throughout for all these pools? Why aren't we taking time to train people to do this and on their own and best standards? The problem is the legislature's arguing that this is duplicative. If that is the case, then what I would expect is that prior to now, our public health districts haven't found any problems with pools. But as you just mentioned, and there's certainly many more cases, they do find problems, which means it is an important oversight. And so given that our legislature has particularly been failing at giving us clear plans for how things are going to work to protect the public, and instead has devoted their attention on really many nonsense items, I am especially skeptical about this one.
I want to go to a listener question, if we can. This is from Ray, and he says, I'm due for a COVID shot. My last one was September 9th of 24. So I was due in April for the 6-month update. Here's my question for Dr. Pate. I hear a new formulation is going to be available in 4 months or so. Would you recommend I get one now and possibly have to wait a couple extra months to get the new formulation? Ray goes on to say he's in his 70s and he does have other health issues. But this could apply to really anyone, Dr. Pate.
Oh, sure. So where we are is for those people that have underlying medical conditions who are over age 60, 65, who are at higher risk with COVID. This is the mid-year time for a booster. And so the answer to Ray's question is yes, go ahead and get your booster now. Now, Ray is exactly right. We do try to basically spread these out about every 6 months, but it is perfectly fine to get the booster. The CDC says after 2 months. I prefer more on the 4-month side of things, but it's perfectly fine to get it in 4 months if it's made available then. But I would definitely get it now because there is benefit to people that are like Ray to get it a booster mid-year like now. And then back to my earlier comments in the show, we are not getting complete reassurance from the FDA commissioner that they're going to approve a next dose of the COVID vaccine. And I'm hearing things that are kind of some nonsense and maybe some waffling. So that will be terrible if we don't. And I do think we will, but I have a little bit of doubt. So yes, go ahead and get it now.
All right. Well, with that, Dr. Pate, so appreciate you coming on and giving us the scientific information. We've been speaking with Dr. David Pate. He is the former CEO of St. Luke's Health System. He is also the co-author of the book, Preparing for the Next Global Outbreak. Remember, if you do have a public health question for Dr. Pate, you can always send us an email, idahomatters@boisestate.edu, and we will try to answer those as soon as we get them in.